Good evening, good afternoon, and good morning. This is the 1459th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. SUMANA Kumari Panda. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and homeopathic doctors. And we have 3 sessions every day. Just we completed a wonderful session from Dr. Mehta in Hindi session. And it's going to be a big Thursday for us because another big session is coming here at English session by Dr. Sumana Kumari Panda, and there will be a big session in Malayalam too tonight. So hope all of you will enjoy the beauty of homeopathy through all these presentations. And let me introduce the guest of the day, Dr. Sumana Kumari Panda, MD, homeopathy, and she was the former district medical officer of homeopathy, Cuttack Circle, Health and Welfare Department, Government of Odisha. She is the consultant, Bhubaneswar Homeopathy Clinic, Cuttack, Odisha. And she is practicing for the last 35 years to treat chronic cases of all type, and more specifically obstetric and gynecological cases, palliative care of cancer cases at the Bhubaneswar Homeopathy Clinic, Cuttack, Odisha. Teaching, she was a teaching experience. She has a teaching experience of more than 18 years at Department of Materia Medica at Dr. Abin Chandra Homeopathic Medical College and Hospital, Bhubaneswar. She has a experience in research also, worked as the principal investigator in collaborative research project under CCRH, Government of India, efficacy of homeopathic therapy on duration of labor. That's a very good subject indeed. And she is a resource person at various induction training, skill development training, reorientation training program, awareness program of HMOs in community organized by CCRH, New Delhi Health and Family Welfare Department, Government of Odisha. She has presented scientific papers at various national and international seminars organized by ELIGA, IIPH, Research Society of India, Andhra Pradesh Homeopathic Association, Tamil Nadu Homeopathic Association, and many other organizations in Odisha. He has published some articles in peer-reviewed journals like IJRH and PUB Medical, etc. She was awarded as the best homeopath of Odisha. Example, Hanuman Primitive Summit in 2014 by Homeopathic Board of Odisha. Best homeopathic COVID barrier by Maravadi Mahila Samaj, Women's Inspiration by Lions Club. Best Women Social Worker by Odisha Navarai Sangha Cuttack Branch, Bharat Homeo Ratna by Wilson Homeopathy, etc. She has served through Lions Club Internationals as diabetic chairperson to create diabetes awareness throughout Odisha and received the most prestigious international presidential medal in 2018. Not only that, she has presented a lot of papers in our forum, and all the papers were really excellent. Last time, a wonderful paper was presented in a different subject, and today, a doctor is presenting another big subject, homeopathic benefit in TOS infections related to repeated miscarriages. As you all know that repeated miscarriages can be avoided by using homeopathic medicines. And nobody knows about all these things, but if you look at every gynecological homeopathic doctors, you can see a lot of cases, successful cases in their kitty. So let us proudly welcome the guest of the day. I proudly welcome all of you to this session, as well as the guest of the day, Dr. Sumana Kumari Panda. Welcome, madam. I shall make you co-host then. Okay. since I couldn't see you. Okay. Okay.
Hello. Namaste. Good evening, everyone. I warmly welcome everyone to this seminar, the IFPH seminar 1359th session. At the outset, I am very much thankful to my teacher, Dr. M.K. Shaniji, the whole organizers, and Dr. Dhanesh, who has given me the scope to speak in this forum. And today is my topic. It is a very important topic, as Dr. Dhanesh told. Thank you, Dr. Dhanesh, for the introduction. So, as he has told that torch infections are very, very important nowadays, and those are causing many more complications. Really, homeopathy has a very good scope in those aspects. So today I am going to share my slide now. Is it visible to you? Am I audible to you all?
For some technical, yes, everything is audible and the screen is visible. You can go ahead.
Okay, thank you, Dr. Bhan. So today my subject is homeopathic benefits in torch infections related to repeated miscarriages. So this topic contains 3 subjects. First, I will discuss on the what is miscarriage and what are the effects of miscarriages. And next, I will go to discuss what are the torch infections and how they affect the general conditions, but particularly during pregnancy, how it affects. And next, I will go what is the scope of homeopathy and how homeopathy benefits to the pregnant lady for in reducing morbidity, in reducing mortality, in reducing miscarriages. So everything I am going to discuss today. So first we should know that what is abortion and what is miscarriage. The word abortion derives from Latin word aborire, which means to miscarry. And in dictionary meaning, if we will go to the 2002, in the abortion is premature birth before a live birth is possible, and it is the synonym to miscarriage. Exactly, before 1985, abortion word was used rampantly in every sphere. But subsequently, Bird et al., after the publication of the article of Bird et al., he has stated that the induced abortion, the medical termination of pregnancy, should be termed as abortion, and spontaneous abortion is termed as miscarriage. That's why usually today's topic is on miscarriage. That is the natural spontaneous abortion. How to, if it is related to torch infections, how it affects the pregnancy, and how to restrict that, how to reduce the mortality and the morbidity, how to reduce repeated abortions, recurrent abortions. So today's topic is based upon that. Usually abortion word is used for induced medical termination of pregnancies. National Health Statistics, the Center for Disease Control and Prevention, the WHO terms abortion as pregnancy termination prior to 20 weeks of gestation, and this abortion is When it is termed miscarriage, when it is spontaneous abortion, when it is natural. But abortion, medical termination of pregnancy is artificial. According to the will of the patient, a pregnant lady, the medical termination is caused and that is termed as abortion. But the spontaneous abortion is termed as miscarriage before 20th week of gestation. After 20th week, it is termed as stillbirth or stillbirth. After 1985 onwards, miscarriage word was used in a medical language to denote spontaneous pregnancy loss for all medical, medico-legal, and social purposes. So the cause of miscarriage, everyone is knowing, just to recollect our memory, past memory. That is, most miscarriages are caused due to chromosome problems related to couples, not only the lady, both father and mother. Other possible causes of miscarriage may include drug or alcohol use, blood clotting disorders, coagulation disorders, exposure to environmental toxins such as tobacco, caffeine, radiation, endocrine abnormalities such as uncontrolled hypothyroidism, uncontrolled diabetes mellitus. Next is infections, and under infection we will discuss today the torch infections. Obesity is a major factor. Physical problems with the mother's reproductive organs, problem with the body's immune response, inherited thrombophilias, and chronic debilitating diseases such as tuberculosis, cancers, and smoking is also a factor. Coming to incidence, what is the incidence of a miscarriage? Around half of all fertilized eggs die and are lost spontaneously. Usually, when the patient knows, when the lady knows that she is pregnant, within that period, the fertilized egg is lost spontaneously around half of the cases. Among women who know they are pregnant, when the periods misses and she goes for the test, and after that she comes to know that she is pregnant. So within that, again 10% to 25% have a miscarriage. Only 30% of all conceptions result in a live birth. More than 80% spontaneous abortions are within the first 12 weeks. So first 12 weeks is very, very vital to take care of, to avoid spontaneous abortions. And half of chromosomal abnormalities and female is to male abortus, the fetus which are aborted, the ratio of male is to female is 1.52 is to 1. 1.5 male fetus abortions is in proportion to female 1%. Okay. Incidence reduces afterwards, after 12 weeks, specifically after 20 weeks of gestation, when the fetus becomes viable. After that, the incidence of spontaneous abortion or miscarriage reduces. Miscarriage in the second trimester between 13 to 19 weeks happens in 1 to 5% of the pregnancies. Pregnancy loss that happens after 20 weeks is called stillbirth. The frequency doubles from 12% in women younger than 20 years to 26% in those older than 40 years. So if the pregnant lady is more than 40 years, then it is the frequency is 26%. And younger than 20 years also 12%. Okay. So what are the types of miscarriage? We know threatened miscarriage, inevitable miscarriage means which is evitable, nobody can restrict. Complete miscarriage, everything, the product of conception has escaped out completely. Incomplete, partly escaped out and partly remaining. In these cases, we have to go for dilatation and curettage to complete miscarriage or any medicines. And missed miscarriage, in case of missed miscarriage, cannot be known through clinically, that can be known only through ultrasonography within 12 weeks. But after that, after 20 weeks, after 12 weeks also, I have seen in my practice in after three cases of missed miscarriage, and that can be known clinically because those were in 16 to 18 weeks period. That's why those are by measuring the height of uterus in abdominal examination, we will be able to know the missed miscarriage, because by 12 weeks we have seen, by 14 weeks we have seen, and by 18 weeks when you will see, the height of uterus will not increase. Then if you will go for an ultrasonography, then that will confirm that there is missed miscarriage. Recurrent miscarriage, recurrent pregnancy loss is referred to as repeated or habitual abortions. So we say historically defined as 3 consecutive pregnancy losses, spontaneous pregnancy losses prior to 20 weeks. In US, recurrent pregnancy loss is a spontaneous pregnancy loss. Recurrent if two recurrent pregnancy loss is termed as habitual abortion in US, but 3 recurrent pregnancy, consecutive recurrent pregnancy loss is termed as habitual abortion in UK. So the definition differs from USA to UK. So next, coming to torch infections, what are these and how it affects, how it is transmitted, we will discuss all these things. Torch, what is torch syndrome? First we will discuss. Torch syndrome may sound like a single illness, but actually it is not a single. It is a group of infectious diseases that can cause serious problems, serious health issues in normal ladies, as well as, but more serious during pregnancy. More serious during pregnancy, it affects the mother and the fetus. If in neonates also, after delivery also, the neonate, the new infant is also affected by these torch infections. So these are quite serious issues. Torch is an acronym representing infections caused by 5 infectious agents are there. Number 1 is Toxoplasma gondii. Toxoplasma gondii virus causes toxoplasmosis. T stands for toxoplasma. In torch, O stands for other agents. Other agents like including HIV, syphilis, varicella, and fifth disease. Fifth disease is otherwise known as B19 disease, or that is due to parvovirus. R stands for rubella or German measles, and C stands for Cytomegalovirus, CMV, insert, and H stands for Herpes Simplex virus. That might be 1, HSV1 or HSV2. So torch infections are a group of congenital infections that are transmitted from mother to child at some time during pregnancy, during delivery, and after birth also. During pregnancy, the virus is transmitted crossing the placental barrier. Okay? And during delivery, the infection is much more, because some of the infectious agents, that is some of the viruses, are highly threaded in cervix and vagina. So when a fetus passes through cervix and vagina during delivery, at that time, the infection transmitted to the fetus, and it is of high risk. After delivery, it is transmitted through breast milk. The infections can spread rapidly through the mother's blood crossing the placental barrier during labor when passing through the cervix and vagina and through breast milk. Why the baby is very much affected? Because the immune system of the newborn is not so strong to fight the infection. Next, coming to complications of the torch, we will find in baby also some complications and in mother also some complications. First, coming to the maternal complications. Maternal miscarriage, especially during the first 20 weeks, in utero complications include stillbirth or intrauterine death after 20 weeks of gestation, intrauterine growth retardation, hydrops fetalis, where in hydrops fetalis what happens? Edema of the fetus happens, that might be due to anemia, might be due to any other serious neurological defects there to the ventricular hypertrophy, like that, hypertrophy of the ventricles of the brain might be due to that. And in these case, stillbirth is very common in all these conditions. So premature birth also happens in case of maternal issues. And in baby, we find the postnatal complications. After birth, we find complications in the neonate, with the neonate or with the infant, includes failure to thrive. It is very, very important. The baby, you might have seen that after delivery, the baby dies due to dyspnea, due to like that. So the cardiac arrest, like that, within 4 to 6 hours, might be 1 to 2 days, like that. That case might be due to torch infection during pregnancy. Okay. So failure to thrive, number one. Number two, ophthalmological diseases like blindness, blurred vision, developmental delays, delayed milestones might be there, paralysis might be there, seizure disorders, hearing loss, deafness, congenital heart diseases, and might be death also, what I have already discussed. So in baby, we may get the complications like this due to torch infections, so which are very serious. So coming to the torch incidence, a study that was conducted on spontaneous abortion cases looking to the influence of torch infections in a first trimester revealed that this is a study which was published in 3rd November 2020, and that study says that the prevalence of 50.7%, 11.3%. The 50.7% prevalence of spontaneous abortion due to Toxoplasma gondii we find during pregnancy. And spontaneous abortion is due to rubella is 11.3%. Due to cytomegalovirus, it is 28.2%. And due to herpes simplex 1 and 2, we find 59.2%. See how much. So it is the high time to think over all these torch infections. Prevalence of infectious agents causing abortion in pregnant women. Torch tests with the serological tests and histopathological analysis. This is published in Applied Microbiology in 2023. This is also a test where they have taken the abortion is a spontaneous loss of pregnancy before 20 weeks, approximately 42 million abortions. Okay, and they have told that the maternal infections that are transmissible from mother to fetus are caused by infections of which the torch complex contributes majorly to neonatal and infant deaths globally. The prevalence of torch infection was 8% in spontaneously aborted women, where we find in and average all infections. The lady was having all types of infections in an average. That study says like this. So now the question comes, is a torch test necessary after a miscarriage? Suppose a patient coming to us after recurrent miscarriage or single miscarriage or habitual abortion. So in that case, definitely the purpose of the torch serological analysis test is to identify any current infections or past infections that can, or which contributed for the past miscarriage. Okay, so in that case, when usually what I do when a recurrent abortion comes to me, I go for a torch test. Whether the IgG factor, IgG is increased or not. And in many cases, I have seen that the parameters of IgG is increased. In some cases, also I have found that the IgM, which is present infection, which justifies the present infection, and IgG justifies the past infection. So the torch serological analysis, always I go for that. And with IgG or IgM or both infections, if positive, I treat accordingly. I advise the patient to not to go for any pregnancy for further 3-4 months, and continue treat our homeopathic treatment. And after that, you allow pregnancy. And when the pregnancy she will become pregnant, that's enough. That's good. So to say, but don't allow pregnancy for 3-4 months and continue only our treatment. And during pregnancy also, I continue the treatment. Okay. So this is all about this. Then next coming to toxoplasmosis. Toxoplasma gondii, which got the infection, the agent is Toxoplasma gondii and the disease process is known as toxoplasmosis. Toxoplasmosis is rare and it is caused by a parasite. It is transmitted through eating foods such as raw foods, undercooked meat, and from the infected feces of the cat, and contaminated water, soil, and litter like that. So that's why the outside food should be avoided during pregnancy, and the fruits and vegetables should be washed properly, very carefully, to avoid the cat feces, contaminated water, soil, and litter that might contain the Toxoplasma gondii. That's why the carefulness should be like this. Incidence and the severity of infection depends upon the fetal age at the time of maternal infection. The risk increases with the duration of pregnancy and the age of the fetus. How many months? In early months of the fetus, the infection outcome is very bad, and in later pregnancy, the fetus may tolerate. But in duration of pregnancy, again, the pregnancy loss, or it affects the fetus 6% at within 13 weeks and 72% at 36 weeks. Clinical manifestations, maternal again, mostly asymptomatic only, can be known by torch analysis. Most of the cases in mother, you will not find any symptom. That's why it is very dangerous. So only we can know while a routine checkup within first trimester of pregnancy. If we are going for a torch analysis, then we can know in many cases. But some cases, the lady may suffer from fever, myalgia, sometimes maculopapular rash, posterior cervical lymphadenopathy, and in this period within the first trimester, if the lady is suffering with these symptoms and with torch IgM positive, there is a risk of 4-fold increase of preterm labor or the miscarriage. Like the miscarriage is less, preterm labor is more in these cases. Toxoplasmosis in baby, what we will find in neonate? Low birth weight, hepatosplenomegaly, anemia, learning disabilities. Many eventually develop the classical triad, that is chorioretinitis, which contributes to blindness, intracranial calcification, which may contribute to the neurological complaints, and hydrocephalus, which usually contributes to convulsive attacks. Okay, in the neonate or with the infant. Infected neonates with clinical signs are at a risk of long-term complications. So don't think that if the child is born, then the newborn is born, that means the complication, the risk is over. It's not like that. The risk continues with for the long-term complications. Yeah, how to prevent already discussed. Don't eat undercooked meat or raw eggs. Keep away from cat litter and cat food. Avoid insects such as flies that may be infected. Coming to other agents, among the other agents included torch syndrome are HIV, syphilis, fifth disease, and varicella zoster. So coming to HIV, almost all US children under age 13 who have HIV got it from their mother's womb during pregnancy. During pregnancy only they are infected. So the test might not show that your baby has it, but it can show up later even after they are 6 months old. After 6 months of age, that if you are conducting a infant, you are conducting a HIV test, that may come positive. So in that case, the infant may have symptoms of retarded growth, might be pneumonia or swollen lymph nodes in abdomen and like this. Okay. So in and the HIV, we know the immunological factors are very less. They are very much prone to the when they grow up, when the age will increase, they might suffer from tuberculosis or cancer like that, complications, pneumonia, many more complications. They are very much prone to susceptible to infections due to less immunity. Next, coming to in other agents, we find syphilis. Pregnant women in the first or second stage of this sexually transmitted, this is a sexually transmitted disease, to their babies. 75% of the time, if it's not treated. If they are not treated, 75% of the time they will transmit the infection to the babies. And if the baby is affected, there might be very serious problems. The baby may not survive full term. There might be miscarriage, there might be stillbirth, or the babies, if the baby is born with syphilis, they may have misshapen bones, anemia, meningitis, encephalitis, and many more types of neurological problems. They may have blindness, may have deafness. So all these disorders may come to them. In fifth disease is caused by parvovirus B19. So usually the ladies are very much immune to this virus. About half of the women are immune to this virus. So their babies are less affected. But if the baby is affected with the fifth disease, then the baby gets anemia, and less than 5% of the women with fifth disease we find miscarriage. Who are the more prone? The ladies with the hemolytic anemias, suffering from sickle cell disease, they are more prone to be affected from fifth disease, and in that case they may transmit to the fetus, and there might be miscarriage. Mode of transmission, fifth disease is through hand to mouth contact, and this disease is very common in spring. That's why this can be prevented as a hand to mouth contact, repeated hand washing. There is no vaccine for this. So repeated hand washing and avoiding the sick people, with the lady can avoid fifth disease. Next, coming to other agents, we find varicella zoster. So chickenpox is caused by varicella zoster, as we know, and it also causes congenital varicella syndromes, okay, in babies. Even if you have chickenpox while you are pregnant, so there is a chance of transmission to the fetus. Okay. When a baby is born with congenital varicella, they may have birth defects. Okay. And if the woman is vaccinated beforehand, then the transmission is much more. So vaccines are available. The lady may be vaccinated 1 month before pregnancy, but never 1 month uh, just before pregnancy or during pregnancy, because the live vaccines, attenuated vaccines, are very live during that period. That's why that will happen. Next, coming to rubella, which is more serious, much more serious, is also known as German measles. This is a RNA tagovirus, a contagious disease. But what we find, this has a negligible effects in absence of pregnancy. In normal man, German measles have very negligible effect. But during pregnancy, specifically during first trimester, during organogenesis, this may cause miscarriage and severe malformations. Okay. So clinical manifestations in normal persons, we find low grade fever, sore throat, arthritis, head and neck lymphadenopathy, conjunctivitis, and rash. Incubation period is 12 to 23 days, and transmission is via nasopharyngeal secretions during the period of viremia, that is 1 week uh, of pregnancy, that is signs, and during rash period also it is viremia period. So during this period transmission is much more. 80% of pregnant women with infection within 12 weeks have congenital infections. It transmitted to the baby and the baby has congenital infections. But if it is transmitted at 13 to 14 weeks of gestation, the incidence of transmission reduces to 54%. And by the end of the second trimester, it becomes 25%. So highest is within first trimester. Congenital rubella syndrome we find in the new birth. Usually eye defects, cataracts, congenital glaucoma. In heart disease, we find patent ductus arteriosus, pulmonary artery stenosis, sensory neural deafness, most common single illness, CNS defects, microcephaly development at Lille like this, and the pigmentary retinopathy, hepatosplenomegaly like this. Fetal effects, we find women with infection are at 4 to 5-fold risk of fetal anencephaly, okay, and fetus with neurological defects. Really, in rubella, I have treated a case with omphalos. That is, the first baby was anencephaly, which was medically terminated. First pregnancy, torch rubella positive, and that was anencephaly was known by ultrasonography, and that was terminated. And second pregnancy, then after 1 year, she went for second pregnancy after treatment with allopathic treatment, but during in second trimester, actually 14 to 16 weeks like that, it came to know that the fetus had omphalos, the partial absence of abdominal wall. And I have treated that case. That was referred by a gynecologist, and I had treated with a tuberculinum to that case, still I remember. And the lady delivered a very healthy baby, and the baby was quite healthy, which was the pediatrician reported like this. And the gynecologist became also very happy after that. So neonates born with a congenital rubella may shed the virus for many months. The neonate having congenital rubella, they are also the source of infection to other infants and to other adults also who are very susceptible. A pregnant lady, for this, the vaccine is available. The lady may take 28 days before pregnancy. And CMV, Cytomegalovirus, is an infection, DNA herpes virus group infection. And coming to clinical manifestations, we find this is of low socioeconomic group. Usually, if as we know, the herpes virus like viruses, they are latent in our body. If the immunity reduces, they are the exciting the factor. If there is any exciting factor or maintaining factor reaching our body, and those are they come out. The manifestation comes out. Okay. So that's happened usually the low economic status, they are having low immunity. They are more susceptible during pregnancy. So in that case, we find uh, the infection is coming out, reflected, the latent infection reflected out. Most infections are asymptomatic, but sometimes in 15% of the cases we find mononucleosis-like syndrome, that is fever, pharyngitis, polyarthritis, lymphadenitis, and rash also in some cases. Transmission is through body fluids, that might be through nasopharyngeal secretions, urine, saliva, semen, cervical secretions, breast milk, and fetal infection usually we find 0.2 to 2% of all. Primary CMV infection is transmitted to 40% of the cases, but second recurrent infection reduces the transmission 0.5 to 15%, and in subsequent pregnancies it becomes 70%. Congenital CMV syndrome, 5 to 6% of the neonates reveal the symptoms like growth restrictions, microcephaly, intracranial calcifications, chorioretinitis, mental retardation, already discussed. Next, coming to herpes simplex. Herpes simplex is also a herpes. Herpes is always latent. Whenever the immunity reduces, that comes out, and most commonly estimated in 0.5 to 2% of pregnant women who acquire HSV1 or 2 during pregnancy. More than 50% of the women, they don't know. 50% of the cases when they reach 20 years of age, uh, they have transmitted herpes simplex virus to other one because they don't know that they are having HSV, that is in latent stage. Okay. Two kinds of herpes simplex, that is HSV1 and HSV2. HSV1 is symptoms are usually blisters around the mouth, but can also be passed to the genitals. Rate is increasing due to oral caution, oral intercourse. The rate is increasing. And HSV2 is a STD that causes genital herpes and can cause blisters or open sores on the genitals or anus. It also causes oral herpes. So here I can say that I have seen a baby of 1 to 2 months with oral herpes. Many times I have seen many cases in oral herpes. The white, completely white coating inside the mouth and burning so much. The infant will cry always and can't nurse. So in those cases, usually I find the anti-include arsenic, mercury, if associated with the bleeding nitric acid, or the syphilitic drugs are very good, well indicated and cures the case. As iode also a very good drug in those cases. Neonatal transmission is by 3 routes: intrauterine 5%, peripartum during labor, while passing through the cervix and vagina, 85% of the infection is transmitted, and postnatal 10%. Neonates usually suffer from HSV2. Herpes simplex, the greatest risk is to your baby if you get your first outbreak of herpes. If it is first time infected, then the transmission rate is much more, already we have discussed. But recurrent transmission, recurrent infections, transmission rate is less. And later pregnancy, if the lady is infected primarily in later pregnancy, third trimester, then the transmission rate is much more, and the baby, the clinical manifestations are much more with the baby, 30 to 50% higher risk, you can say. And once transmitted, usually the herpes simplex virus, they remain latent in cranial nerves and dorsal spinal ganglia. So that is more dangerous. And the baby grows when he becomes very young. If the immunity reduces, most finally it suffers. And if during pregnancy, primary infection during pregnancy, the transmission is there, there may happen miscarriage or stillbirth. So clinical symptoms, we find localized disease in newborn, localized disease of eye and mouth in 35% of the cases, CNS disease such as encephalitis in 30% of the neonates, and disseminated disease with involvement of multiple major organs in 25% of the cases, where mortality rate is 30%. So it is a serious developmental and central nervous system morbidity in neonates with this 50% are the survivors with disseminated or cerebral infections. Okay, and 50% die in this case. So what is the homeopathy benefits? The third part came. Our work is to prevent complications both in mother and in infant. How? Through selection of constitutional remedy on anti-miasmatic basis, through case taking and taking into account the pathological symptoms, serological torch analysis, that is giving importance to both IgG and IgM parameters. What I have done, I am sharing my experience. So torch analysis, serological miasmatic analysis, I have taken the symptoms, and in toxoplasma, it is coming under miasm tubercular. Other agents, HIV, miasm is tubercular, syphilis, syphilitic miasm. Fifth disease, usually which is causes anemia, is again a syphilitic miasm, and varicella, usually psychosis. Rubella, usually coming under all the symptoms already discussed. So these manifestations are coming under the miasm tubercular. Cytomegalovirus, again the miasm is psychosis, syphilis, but dominant tubercular. Herpes simplex virus, usually we find miasm syphilis under syphilitic miasm. So some clinical tips I must share from experience to prevent miscarriage. Because when a lady comes to us after recurrent miscarriage, most of the time I have gone for, as I discussed, that I have gone for the torch analysis, and by taking into account the IgG, IgM parameters, we have seen that the IgG and IgM parameters also contributed to some extent. We have to reduce them. So taking into account, I have gone for the constitutional remedy selection along with intercurrent nojodes, anti-miasmatic nojodes. So with that, I have seen that in further analysis, the IgM level reduced, and it has prevented miscarriage in many cases, and malformations, morbidity and mortality also reduced through our treatment. I am discussing related to repeated miscarriage. So number one, in case of, suppose a case came to us with in case of multiple or single infection, IgM positive. Multiple means, suppose the lady is having Toxoplasma IgM positive, Rubella IgM positive, CMV IgM positive, like this. Or someone is having Rubella IgM positive, CMV IgM positive, and HSV IgM positive. Or someone is having, or single, only Rubella IgM positive. So in higher grade. So in that case, I had gone for anti-miasmatic constitutional remedy, taking the totality. That is the presenting complaint with the PQRS, history of present complaint, physical generals, mental generals, past history, family history, like this. So with the totality, I have gone for the selection of anti-miasmatic constitutional remedy along with an intercurrent anti-miasmatic nodule. That is just like tuberculinum or carcinosine or syphilinum, basing upon the history and mental generals, which was trending towards the nodule. I had gone for that intercurrently in fortnight intercurrent in or in severe cases, in urgent cases, even if I have gone for weekly intercurrent and with anti-miasmatic constitutional remedy. either in fractional doses, the diluted doses, or sometimes in millesimal scale also I have done. So that have given me very good results. In case of multiple or single infections, IgG positive. That means the past infection was there, and that's why the repeated abortion happened. And during high risk period of pregnancy, that's why the transmission occurred and the uh, miscarriage happened. In those cases, the same principle, anti-miasmatic constitutional remedy along with an intercurrent anti-miasmatic nodule. Like I had gone for tuberculinum or carcinosin or syphilinum, like that, which is indicated. In case multiple or single infections, IgG positive, there is no IgM positive and a low risk period. Why I told previously the high risk period, this is during pregnancy. Already the lady is pregnant, and in first trimester of pregnancy, during routine examination, it came to know that she had history of miscarriage, and now it came as the IgG positive. And so that's why the lady is in a high risk period, because she is in first trimester. There might be again miscarriage. So we have to prevent that. In those cases, I had gone for constitutional remedy along with intercurrent nodule. But if it is in low risk period, that means suppose the IgG level is low, and there is no pregnancy in history of miscarriage, the lady has come to us to prevent miscarriage in further pregnancy, in future pregnancy. So in that case, only I had gone through anti-miasmatic constitutional remedy. I had not gone through any nodules. But in case of varicella infections, specifically IgG or IgM positive, I had gone through anti-miasmatic constitutional remedy with along with Fuja or Medurinum according to symptom similarity. We have to find out whether Fuja is indicated or Medurinum is indicated as an intercurrent. Again, in case of recurrent or repeated history of miscarriages, it's due to torch infections. And now the woman with yes, in this case, what happens when the lady had 2 to 3 abortions, 4 abortions, even I have seen a case of 9 abortions. Then after that she came to me, but I failed in that case. That is chromosomal abnormality. Also the 10th one also miscarriage. But up to 5th abortions, 5 miscarriages. After that, the lady has come to me, and I have treated with for 3 to 4 months, avoiding pregnancy, advised to avoid pregnancy, continue medicine, the constitutional remedy along with intercurrent nodules, so, and then allow pregnancy and continue the treatment, same principle throughout the pregnancy. And the outcome is very encouraging in all those cases. Miscarriages related to torch infections can be treated successfully through homeopathic constitutional along with anti-miasmatic remedies. Thank you. Thank you all for the patient here.
Thank you, Dr. SUMANA Kumari Panda. It's really an excellent session indeed, and that's you show the beauty of homeopathy in this session, because we know that a lot of doctors are practicing homeopathy in the field of infertility, and those people are doing all these things and definitely will be the beneficiaries of your session. You really excel in this presentation. You show how one need to look into all these conditions and how one can trace the case and how one can go ahead with your prescription and what
Dr.
are the...
Dr. Dhanesh, just one second. In future sessions, I will go for the case series related
Exactly.
to these torch infections.
Definitely. That's also in between. You have shown some of your cases also. That's the beauty of the presentations. Anyway, we are really happy to have such wonderful present in this evening. As you all know that we are celebrating the fourth anniversary of IFPH tomorrow in our English as well as in local language session. We have arranged a very good session for tomorrow. Our national chairman of homeopathy national council, that is Dr. Anil Khurana, will be the person to inaugurate the session in English, and a lot of guests from international side are joining to say felicitation. And Dr. Ismail Said, our president, will be giving the presidential address. And in the Malayalam session, we have the agriculture minister from Kerala, that is Dr. Sri P. Prasad, will be inaugurating the Malayalam session. So tomorrow will be a big day as far as the International Forum of Homeopathy is concerned. We welcome all to join tomorrow's session. Try to join with your video so that our guests will be very, very happy to see all of you in the frame. So hope all of you will be with us tomorrow at 8:30. The same time, since there is only few minutes remaining, I invite Dr. Ramadevi Ambadi to say a few words on this session, as well as a vote of thanks to the session at the end. A lot of questions are there, but we will definitely arrange a session for those who want to have a chat or to clear your doubt. We will definitely have the next session in the September itself from Dr. SUMANA KUMARI PANDA. Already we have fixed the date also. We will announce it later. So it's over to Dr. Ambadi, madam.
Hello, can you hear me? You
Yes.
can hear? Okay.
Yes.
Yes, madam.
Dr. Sumana Kumari Panda, it was very nice session. Thank you a lot. See, we used to treat infertility, and we will be having all these problems. Then we will give, as you told, we will also give nosodes plus toxoplasma. It is very effective for this this Dodge positive cases, isn't it? Have you tried it?
Yes, madam. Really, Dr. Dhanesh has given a very good appreciation about you, and I am very much interested to talk to you to discuss regarding the infertility, all gynecological disorders with you. I am very much interested, really, madam. And I got the number also from Dr. Dhanesh. I called you one day, but there is no communication. Really, I can't connect you.
My phone was hung. Last some days, my phone was hung. Even my friend Dr. Santa also is very expert in this.
Really, I am very much interested to learn from you, madam.
Surely, we will all discuss. We will all share. Okay, thank you, madam. Thank you. It was very nicely explained, and very nicely. Actually, you have gone through all these sessions of this toxoplasma, this torch. Then I convey my thanks on behalf of me as well as the IFPH members. Thank you a lot. You should come again and again. With our cases, we are expecting you to come.
Thank you, madam. Thank you. Really, for case series, I am torch. That will be published shortly. That's why after the publication, I will go for that case series into IFPH only.
Very nicely explained.
Okay, thank you, madam.
Thank you.
Thank you.
Thank you.
Thank you, Dr. Dhanesh, and all Dr. Sani sir, and all my dear friends for patient hearing. Thank you.
Thank you, Dr. Ambadi madam, and Sumana Kumari Panda, and those who participate in the session. Thank you all. Good night. As you all know that tomorrow at 8:30 we will have a wonderful session coming, and all of you will be. All of you are expected to join in the same with your video, so that we can celebrate together the beauty of homeopathy and beauty of IFPH. Thank you all. Good night. It's over to the Malayalam moderator.